Today we are in Homa Bay County to participate in public forums where we are subjecting a proposed intersex bill to public participation. This bill is very critical towards the protection and promotion of the rights of intersex persons in Kenya. You will recall in 2019, during the national census, the country was able to capture for the first time the number of intersex persons in the Republic of Kenya, 1,524. And for the case of Homa Bay County, we have 23 intersex persons. However, you would also note that during this census, we didn't capture many of the intersex persons due to some reasons like stigma, for example, lack of awareness for them to come out. So this journey has been for over 10 years that the Commission has been working towards ensuring that we have a framework to protect intersex persons. We have been working very closely with the Office of the Attorney General, the Kenya Law Reform Commission, to ensure that then we have a framework as part of the deliverables based on the work that we have been doing all along. There is a gap in terms of law, and this is the gap that the Commission intends to fill. For instance, some of the questions we ask ourselves: how do the intersex persons, for example, access, education? Do we have facilities that cater for them when they go to seek, education as a right? How do they get services, for instance? And you'll be surprised, for instance, that intersex persons are not covered by NHIF, for instance, among other, provisions which other Kenyans enjoy, but they do not enjoy. And the question of hormonal, for example, therapy being costly should not be the reason why we deny intersex persons, to enjoy their right to health. Issues around employment opportunities, for example, are some of the issues that affect the intersex persons, and therefore this law will ensure that in terms of affirmative action, in terms of also enjoying employment, there will be a framework that protects them to enjoy their rights just like all the other Kenyans.
And if you talk of NHIF and other services that they don't enjoy, what are the reasons the government is giving that prohibit them from benefiting from NHIF services?
I think it is that lack of awareness even among the duty bearers like NHIF, and that's why the Commission, working with other stakeholders, we now want to see that within this framework of the law that we are proposing, they are fully catered for without any discrimination. We can say that is discriminatory, of course, but this is the cure that this law is looking forward to do.